Have you injured your spine, still have pain, had an exam and possibly even some imaging, and told everything is normal? Do you still hurt and know something is not quite right and don't know why? Don't worry, you're not alone. There are some injuries that are frequently missed, and we are going to go over one of those injuries here today with a small 4-part series. This one's on ligament injuries. Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I am board certified in rehabilitation and fellowship trained in primary spine care. In addition to my education, training, and experience, I've been managing ligament injuries in my patients for decades. Now, please note that these videos are not a substitute for professional medical or chiropractic advice, for diagnosis, or for treatment. These videos are for informational purposes only and educational purposes only. Now, seeing the wrong doctor can result in an incomplete diagnosis, the wrong treatment, persistent pain with poor recovery or no recovery. So, in these videos, there's going to be 4 parts. The first one, which is this one, we're going to be going over what a normal ligament is and what it does. Number 2, we're going to go over what the injury looks like. We're going to talk about the different types of injuries that you can have. In video part 3, we're going to review what common chiropractic treatment is and what the management of ligament injuries looks like. And in part 4, we're going to go over what can you expect in the long run? How do these injuries recover? So, let's get started with part 1. So what is a normal ligament? Well, behind me here is a poster that I use with my patients. This poster shows the spine anatomy, and it shows a lot of the extensive ligaments in the spine. Ligaments are, first of all, straps. They hold bones together. So the bones are not one continuous piece of bone through the body, but they have surfaces where the bones will meet. These straps will surround these surfaces, and it's called a joint. These seatbelt straps are subject to tear, also subject to wear and tear. And these straps function to keep the joints stable. And stability means that the joint can withstand loads, which is like compression. So if you're standing and walking, and not buckle and give way. Now, also inside of these ligaments, this is what's really important, there are nerve endings. Now, these nerve endings talk to the body. They communicate what's going on. Stretch. If you stand on a joint, rotate and twist it, there's going to be strain through there. That information has to be communicated to the surrounding muscles and to the brain. So the joint receptors, the nerve endings, will communicate that. If there's too much tension in a joint, there's going to be a reflex stabilizing response of the surrounding musculature. Also, if the joint gets injured, it has to communicate pain. So it has to give feedback to the body to that will result in increased inflammatory response and increased repair and healing, and then also for protection. Finally, there's stabilizing muscles around a joint. So just even with your normal day-to-day activity, they need to get turned on or turned off depending on what the joint needs. So these nerve endings communicate back and forth with the surrounding tissues, local tissues in the brain. So the spine is divided into 4 sections. You have the neck, which is the cervical spine, the thoracic, which is in the middle. That's anything that's got a rib attached to it. You're going to also have the low back called the lumbar, and then you've got the tailbone, which is called the sacrum. Now, the sacrum is kind of pinned in around the pelvis, and then there's joints on the left side and joints on the right side. Those are called the sacroiliac joints. So ligaments have this crucial biomechanical role of allowing the spine to bend, rotate through a combination of the straps that are mechanically holding everything together, and then the nerve endings inside that are communicating in real time, giving real-time muscle contraction, muscle relaxation, and helping the body move together. There's also another role that's called proprioception. Proprioception is the ability for your body to know where it is in time and space. So for example, I'm holding my hand behind my head. Now, if I'm holding up 1 finger, how do I know that? I'm holding up 2. How do I know that? You know that because there's nerve endings inside those tissues, inside the ligaments, inside the joints that is giving feedback to the surrounding tissues. Your brain learns how to do that. So that's another appropriate and important part of ligaments that we have to understand. So these tissues are giving us instantaneous feedback when we're out on the soccer field, running around, or playing football. Now, why are these injuries missed? That's a very common question. Well, it comes down to honestly training. You know, in order to identify an injury, you have to know what normal is. Secondly, you have to understand injury mechanisms, like what type of events can damage these tissues. You also have to know what the damage looks like. How does it show up? How do patients complain about it? How do they report it? You know, nobody walks in going, I think I'm having a damage to a ligament, and then they name it off. Nobody understands those Latin names. The average public does not. So we have to know how to find that. Also, we have to know how to image it. We have to know how to do a physical exam. And to be real honest, this is not something that is commonly part of a lot of the curriculums that are out there. This is more postgraduate work where we're doing more detailed evaluations on what a spine injury looks like. So to bring this into a full circle, ligaments have a biomechanical role where they hold the joints together. They have a neurological role where they give feedback to the surrounding tissues. These injuries are oftentimes the easy ones are frequently identified, and then of course the catastrophic ones where there's full joint rupture, those are easily identified. But the ones that are in the middle, the ones that are persistently painful, those are the ones that oftentimes get poorly diagnosed, they're frequently missed, and we're going to kind of go over some more details with that. So thank you for taking the time to watch this video. There are many voices for you to pick from. I'm honored that you chose this one. So until we meet again, thank you so much for watching this, and have a blessed day.